This is what we do, by the way, in the lab all the time, is just always be comparing the patient's complaints with this iris and sclera signs. You always want to do that. Always go back and forth. They said they have this, but let's see if we can see some sign of that in the eyes. And then they had a medical procedure over here. They had a surgery. Like this particular person had a cataract surgery. Can we see signs of that? And you'll see when we look at the pupil, you'll see. So it's always important for us as practitioners to always be going back and forth. What are the signs and symptoms? What does that look like in the eye? What are the signs and symptoms? Let's see what it looks like in the eyes. So that's our procedure. That's what we do. That's how we learn. Right. So if somebody says, they call me and they say they have a certain disease, and I realize, hey, I haven't seen anybody with that disease yet, and I can hardly wait to see their eyes. I hardly wait for them to come in. I got to see their eyes. I have to see what this looks like. That's one of the things that really excites this man. Eyeballs. Yeah, we're the eyeball people. We keep learning more things. So I have 3 different research projects going right now. We're expanding the map of the etheric. So eventually that will come out. And Nenita, thank you. She just, I don't know if you can see this. No, you can't because our camera is turned off. It's called the Grand Medicine Sclera Marker Locator. And yeah, well, I'm not going to show it, but this is going to be available within the next 2 months. And it very precisely locates every area of the body, including many brain areas. So it's unique, it's different, so I can hardly wait until we can present this. And it will be offered in conjunction with the 2nd edition of the Grand Medicine map book, which is greatly expanded. So Nenita's working on that. She's doing the artwork on it now, and as soon as she's finished with that, then we'll let everybody know that it's available. And I've known him for actually many years, and he first approached me in 2015, and so over those years, each year there was at least some little connection.
Maybe you could, André, you could put his eye images now.
Yeah. So while I'm talking, André will show you some of the images. He has arthritis, okay? So that's what he confesses to. So he says that he hurt his back from time to time, including while he was in the Army. He says that he may have hay fever type of allergies. In 2016, he said that he had a lot of allergy symptoms, including runny nose and itchy eyes. He said that he is, he's on thyroid medication. So he said that he broke his left wrist and his right elbow. So you can look in those areas at about 4 o'clock. There's those white, you see those white radials. There are subacute white radials coming down there in the arm area. So he said that he had a flu shot, he had a pneumonia shot in 2019. I'm not sure why he had that pneumonia shot, but this is a person who follows medical advice pretty closely. He isn't all that familiar with, nor does he all that much trust natural medicine. He trusts medical doctors and their concoctions much closer than he does natural. And he confesses to a preference for sweets. This is something to remember as we look in the scleras, especially the right lower quadrant.
Yeah.
And his desire for sweets. So just remember that when we're looking at the pancreas area in the right lower quadrant.
Yeah.
He confesses a coffee addiction, in which he adds milk and half. He has that every day. I'm not sure how many cups. He mentioned problems with his mate relationship, his wife relationships. And that's been ongoing for a number of years. He says that he has a few superficial malignancies that were actually in the bladder, the urinary bladder, few little cancers, and they were removed in May of this year.
And it also, if you could take a look just quickly, one of the prominent features that we could see about his symptoms in the bladder area, urogenital and the back, is look at the right pupil, and there's an ellipsis of flattening, right there, and also look on the sclera, and you see that IC line that goes along through the medial quadrants, medial going to the lower, right there.
Also notice, I'll mention two things. He's had prostate difficulties for many, many years. Also notice that in the wreath, the iris wreath, is introverted. It's inverted. This is Russian iridology. When the lower aspect of the wreath is inverted toward the pupil,
both of them.
Both of them are in this case. There's a problem. There's going to be a problem with sugar metabolism, pancreas metabolism. Another thing is, notice how very, very black the pupils are. He, at sometime around 2015 or so, he had a problem with cataract, and he had those removed. See, so he has new lenses put in. So that's why, at his age, at age 80, he's 80 years old. At his age, there should be some kind of material, at least buildup of minerals and such, in his pupils, but they're perfectly black, just like he was just born. So he had those removed.
Yeah, if you see a pupil that's perfectly black, especially with elderly, suspect that there is some kind of surgery or lens replacement that took place.
Okay. So we can probably, with that, unless someone, you want to say something, Nenita, about his personality, about how he was born?
Yep.
He was born apparently a vital peculiar, because we see a lot of vital in him. The lines, the individual iris fibers are fairly close together. There are only a few lacunas of any size, so he's mostly a vital, isn't he? A little bit of peculiar in there. And there are some jewels, several jewels have developed. So that's another suggestion. That adds another a little bit to his personality. And I can say something else about his personality that can help. He's not really all that much of a social person. He lacks in some of the skills, the social skills of getting along, how to approach, how to present himself to other people so that they will receive him nicely. He comes on pretty strong sometimes, and he'll bring criticism to people without realizing how to bring criticism in a way that they will be able to accept it. Okay?
Yeah, and that goes along with the pigments that's mostly concentrated on the GI area zone, which is in physical iridology. The orange is most talk about the sugar system or the endocrine, and then the brown talks about the liver. The concentration of the pigments right on the GI zone, that's also talks about moving toward mental, cerebral. So in terms of the personality, that's why he doesn't quite relate well with people, because he tends to approach life more on the cerebral aspect.
Notice also the stomach ring. So whatever he eats, he had better chew it very, very carefully, and it had better be really good quality. So for about 20 years of his life, he was over in a South Seas island, and he ate a lot of raw food, a very high percentage of raw food, which helped him. But you can also see a corneal arcus. You see that corneal arcus? And so that was just a part of his life, because remember, he's 80 years old. And when he was not on that island eating all those raw foods, he was eating all kinds of other things, which is reflected in that corneal arcus, which means he's going to have some liver difficulties, which we will see later. Okay, Andre, you want to say something now?
May I?
I'm sorry, you can't say anything more. I have a lot more things to sclera to talk about, so we'll do it next time. We'll give you your share next time.
Can I say a little things about emotional aspects? He's got a couple of lacunae on particular areas. Okay, so and these areas show us and talks give us information about particular aspects on his emotional things, which show us two things which we can think that it has relation what Dr. Leonard and Nenita are saying. So first, it shows the rigid aspects of this character, okay? So this kind of lacuna on this area, right? It talks about rigid pattern of person. It's a pattern which he has believes that he must be very strong, and strong meaning that he must be rigid, okay, not flexible on this aspect, right? But rigid and not flexible about what? It does also has something very, very pontual, very bem, Celso bem pontual, né? Sometimes I'm going to ask Celso some help for translation for particular words, okay? So, Celso, bem,
You
bem
can say
pontual.
you can say very specific.
Yes, yes, yes. So it is specific things. And what is these things about rigid rigid carrot? It's about things which talks about justice, right? The possibility that this person, when connected, when involved with things which is about justice, about himself or people around him, right? That kind of things makes him very fragile with these things. What I'm trying to say, it's shake him, right? This is the kind of emotion that shakes him, okay? And so he's rigid, he has rigid carrot, and has fragile things with justice, with being comparison, ser comparado, Celso, ser comparado e ser julgado, okay?
Yeah. Let me go back a little bit
Okay.
to the term when you mentioned justice. Also, together with this term justice, you can also add fairness, being fair, right? Because
Yeah.
justice sometimes
Yes. Yes.
justice relates to the law.
Yeah,
But
yeah, yeah.
in
It's
this
not
case,
about the law. It's about to be
right,
fair.
right.
Yeah, that's the
Yeah,
point.
being fair,
Yeah.
fairness. And
Fair and
that,
unfair things makes him,
yes,
oh my God. Okay? That's okay. That's annoy him. That's bother him. Okay?
right.
So this is comes from his essence. This is on his instinct, right? That's not something that is not becoming from his history, right? He is like that. He came like that. He grew up like that. Okay, so that's coming from de outras gerações, Celso. Né? Ele herdou isso.
He brings this from other generations. It's already in his backpack. already in his history.
All right. So let's
Okay.
go through, and I'm trying to be more fast, okay? So it's important to understand the things that happened during his life. It's not correlated with this lacuna. The lacuna shows his fragility, a sensibilidade dele, his sensibility for these kind of issues, of emotional things.
Sensitiveness,
Okay.
sensibility.
Then we have the pigments, right? These pigments like orange, as Nenita was saying, around nutritional area, right? These pigment in specifically, it's correlated about exactly about his feelings that he developed during his childhood and during his life, the experience that he has during his life, about how he became bored, incomodado, Celso, com questões de correto ou errado, to be fair.
He gets annoyed, very annoyed and very bothered by this condition, and also by being compared to other people, which he's not taken for what he is, but he is compared to others.
Okay.
Yes,
And
and
We can verify this. We
we
can
can
yeah, yeah.
confirm this.
verify that based on his personality, because that's what makes him hard to be in the social settings.
Difficult.
Yeah, yeah,
Very good. Thank
yeah.
you.
That's right. That's right. Okay. I'm going to try leave my microphone on, and maybe Leonard too. If we don't get echo, then we can talk together. So exactly, I'm sorry, Leonard, if I get too long on this explanation, but it's very correlated about the case, yeah, about the history that you are saying. So that means that he's got his sensibility from his own self. It's from his nature. That's from his nature personality, right? Then he has events during his life, that situations that he felt these things for many times, many situations that make him feel, wow, that's not fair with me, or maybe not fair with someone that I love or someone that I care. Okay, so he get too long thinking about these things and nutrition, these kind of feelings, right? And that helps to appears this kind of pigment in the iris, right? And this is, we can get together, we can make comparison exactly with this sign. We have hyperactivity sign here, right? Okay, and this is very specifically area. It's very interesting because I'll show you the map here. Yeah, so this fibers here, this trabecula, as you prefer, is exactly, please have a look on the camera here, if you can see. This is the area on this blue area here on the map that I'm holding, okay? It's exactly there. And it's showing how he works, how he has a very strong thought, and ele alimenta esses pensamentos, Celso, very strong, repetidamente.
He repetitively nurtures these strong thoughts.
Yes, about the correlated with fair things, as the echo, about this kind of things, right? And that makes that makes all these pigments around. correlated with that. All right, then. Thank you, Leonard. Sorry if I got too long. Let's go on.
That's good.
I can see that we're going to need to do these, give more time to these because there's just so much information there that I want to, we both want to really talk about. So we could probably go to the scleras.
Yeah,
And
yeah,
now,
yeah. Let's go. Let's go to the sclera.
before we go to the sclera, also the terms again with the pigmentation being orange and all the particular things,
Inverted wreath.
inverted wreath, and then if you look right on the left eye, right below is there is a strong markers right there, and it goes into the emotional aspect of the pancreas.
That's the one right there.
Yes.
That one goes right into the emotional aspect. But this one down here, which we were going to get to later, that's the pancreas very directly, the main body. So we can probably go
Let's
to the
to the
scleras.
sclera. Okay. Yeah.
The very
And
next one will be the left lower quadrant, I believe. Is
okay,
that
I'll go there through. Just about what Nenita said. 1 second. Just one little point on here. There. Okay. This, which is nearby the pancreas area, as Nenita was saying. Sorry, Nenita, if it wasn't exactly this one. Anyway, but this one, it shows also these same aspects that we were talking before, but also shows how much this person being thinking about possible projects on his life, wishes, and things that he um, couldn't practice, couldn't não conseguiu realizar seus projetos, desejos e coisas que ele não conseguiu realizar e pode se sentir
Projects and desires and wishes that he was not able to fulfill or to achieve. So he felt or feels completely frustrated by it.
and resentment and things like that. Okay, I'm finished. I won't see
okay?
this. There is again.
I'll just mention that to a couple of things. Obviously, people are going to need to have that map, that wonderful map that you just showed us. And with regard to Celso, I don't know if we properly introduced Celso is Professor Andre's slightly older and handsomer brother. So you'll see in the left lower, whenever you see I don't know if he can point to that one. You see that, well, you can see that there are neoplasm vulnerable areas, NVAs, neoplasm vulnerable areas. There's a few of them, and there's several of them in the right lower. In the left lower, there are still a few, okay? And you see the marker that's coming from the left kidney, okay? And it's going up into the transverse colon, and it's actually ending as an N5 and maybe even an N6 if you follow that line up. The one that starts in the kidney, okay, and that's right. Thank you. There you go. So it looks like it's an N5, maybe even an N6. The hook up there, and then there's another marker that Celso was referring to. Yeah, we're going to look at both of those. That goes to the right of that. It goes into the E pancreas, the emotional pancreas, and that seems to be thickening and ending in an N5, neoplasm vulnerable area. So these are potentials for cancer.
Yeah.
Okay, and then the one over on the left in the lower back area, remember he mentioned the lower back always gave him problems. So many times he had problems with the lower back. That's an N7 marker there, up there, you see. That's an NVA, N7 NVA up there. See where it's thickening? It's thickening, and it's actually pointing right at the lower back. Up a little further. Up a little further. You see that thickening line there? That's an N7, right?
Here?
Very good.
Okay.
So, and then we go over to the right. Of course, the bowel is the area where most of people's problems are. There's so much more in that left. I'd like to spend another half hour describing things that are going on in that left lower quadrant. But the right, of course, with just for fun, we diagrammed this. So you can see there is a lot of kidney involvement, but there's adrenal involvement also,
Yeah.
and the adrenal is connected to the thyroid. So there are many, many endocrine system markers in this person's eyes. And that's another whole program to talk about his endocrine difficulties that the medical people only discovered when we told them about it. And they did some of their tests, and then they find, thank you very much. And then you see there's an N6 there that's involved with the lower back and the prostate.
Yeah.
And he's had prostate in the urinary bladder. So that line that starts at the adrenal, the right side line, it goes up, it goes through the urinary bladder and prostate, and it actually connects with the thyroid. So the thyroid is sending bad signals that are hurting the prostate and the adrenal. Okay, but then when we look on that heavy marker, the biggest marker in his eyes, it turns out, okay, it's coming from the bowel area. It's going up. There's an N8 there, neoplasm NVA marker, but then it winds up as an N5 NVA right there right in the smack in the middle of the main body of the pancreas. So now they didn't say anything about his sugar problem. He did, and they haven't really made any discoveries on that yet, which they should have by now, because that's probably the most vulnerable area in his whole body. But he has several of these signs, and he has them in other areas. Okay, he's 80 years old, but does that mean that he should have all kinds of problems happening to him? No, not necessarily. But as Professor Andre pointed out, his personality lends itself to this kind of difficulty because it's not just physical things. The diet isn't the only thing. There are several other energetic areas, the etheric, the emotional, the mental, the psychic, for God's sake, the psychic. These are all, there's energy that with some people, it's all psychic that's causing their problems. So you have to be able to understand this and be open to it, which medical people, they're stuck in the gross physical. They say if there's a physical problem, we're going to give it a drug and deal with it, and that's it. But that's the way they think. Well, Andre, please.
What you are saying, which is very interesting, very nice. Let's have a look very fast here. You have adrenal area, okay, correlated, and that can tell us and makes us to ask him how he feels about his relationship with social aspect, how he leads with friends, to make new friends. I mean, not his own relationships, right? But new people. How is he open to make new friends and be exposed, right? So on this area, and it's correlated with adrenal as well, right? We can bring this kind of questions, right? So which this kind of lines on this area can make us to ask and think about how does he relate himself with outside, with social things, right? And it can make things as well. He can think that the world is not a good place to live. You understand what I'm trying to say? I mean, it's dangerous. He's not open to expose himself easily, right? Does that make sense, Dr. Leonard, please?
Yes, that's good. That's him, all right. Very good description of him.
Okay,
Yeah.
then what we have, what I really love on sclera, right? I don't like to make comparisons, right? I think each structure has its own work, right? Contribution, okay? But on sclera, we can see things happening, and also we can see the things changing, and we can see exactly which is the emotion involved. We can see the intensity of the emotion involved, right? And we can see as a chronologic way as well how long this have been alimentado, Celso, tu já falou antes.
Going on.
Yeah, how long this have been feed, yeah, this kind of feeling. So here, on this sign here, we can see, and it's on the pancreas area, right? Again, it's confirming what we saw on the iris. It really shows that he's been feeling and feeding this kind of emotional, right? On the moment that these pictures were done, right? So that he really thinks about the things about if it's fair or not, and having this kind of situation happening. That's what I'm trying to say. There are something happening on his life on the moment that this picture were done, right? And he is feeling this a lot, okay? This kind of emotional about fair things and probably about himself involved, okay?
I think, may I
Salsa.
add? May I add? I think in other words, what you can say is that the sclera signs will show you in a very dynamic way how things are actually happening at the moment.
Yeah, yeah. This is the other map where we see emotional on the sclera, right? This is Dr. Leonard's map in Portuguese, and this is emotional aspects on the sclera, behavior, emotional, and all things.
Yeah, I saw a couple of people ask about the map, so I think it's going to be important for you, Professor Andre, to let everybody know how they can get that map from you.
Yeah,
Okay.
sure. At the end, we can talk a little bit about that. Okay.
Mhm. So we can go to another cue.
Another cue. Okay.
Can
Which
you
one?
be the lateral?
Want to go to the laterals? Let's go to the laterals. Because his irises showed, his left iris in particular, but also the right, that he had some inherited tendency in the heart area. But see, we have to look at the sclera to see what has developed in those areas, the heart. So you'll notice that there is the reason why I take two images of each lateral quadrant is so that you can see problems that are potential way out there in the arterial coronary and the venous service to these. So in this particular one, this is here's what I do. I say, okay, I want you to look to the right so I can get that left lateral quadrant. And then I say, I'd like you to look there again, but as far as you possibly can. And I purposely leave out most of the iris so that I can get all the extreme area of that quadrant, so I can see if there are any special markers in the arterial coronary. And of course, in this case, there are, but there's also that connective tissue. Can you point to that white blob in the corner? That's the connective tissue dysfunction, CTD, connective tissue dysfunction sign. Okay. So that shows that there's a problem with connective tissue in his body. And connective tissue, of course, it's all through the body. It's a support system. It's one of the main supports. It holds organs up, for God's sake, and does all kinds of great things. So there's that. And well, we could just go on and on and on for hours. I have medical reports from him, surgical reports from him. And they found a problem with his aorta, the thoracic aorta, and that shows up as a thickening here in the very center of the map, pointed right toward that line that points toward the iris. That one right there, yeah. Okay, that's right in that area where in the thoracic aorta, abdominal aorta, which they found some thickening of tissue, right? And so that involves the heart, and of course there's a little bit of a red wash, and you'll see the red wash is more easily shown in this right lateral quadrant, a little bit of red wash over there. Okay, so he does have some vulnerability in that heart. So of course it's
Especially the right side of the heart.
yeah, especially the right side, because watch where that line goes. See the biggest line in the right lateral quadrant. Watch where it goes. It comes right from the venous blood service, the venous service to the heart, and see how it what happens to it. See where that line it gets thicker. You see, so it's an N5 marker in the heart, actually in the right side of the heart. So that makes his heart more vulnerable. So he does need exercise. You know, he needs his yoga and his exercise, but it can't be anything violent. It can't be like younger people. But it's important that he has it, and in correlation with his diet and what he does with his mind and his emotions. See, yes. Okay. Did you want to say something about some of those other markers that you were pointing to with the arrows?
Yes, please. It would be interesting to talk with him and see how is his self-esteem, okay? Which is probably he has the beliefs that he's not good enough, okay? And that's not from now, that's from the whole life, always thinking that he has to do more than his ability.
I confirm that. I confirm it.
Okay, perfect, right? And we are seeing this exactly on this area here, okay? So before I said about the rigid character, right? And now we can see about what. So he's really has probably, yeah, a self-esteem issue, okay? And that's explain why he's too rigid, why he push himself too much, right? And must have everything all correct, everything very, very right. And always when he received something from outside, from someone else, saying that, wow, that could be a little bit better, right? Can you do just a little bit more, that on that, to get 100%? Wow, that's maybe he received that with a very big problem, right?
Yes, he has to. You could say it, Nenita. It has to
He,
be done his way, this way that he learned it. From it has to be done that way, or it's not right.
yeah, and he has a tendency. What also interesting is if you look his eyes overall, most of the biggest, thickest, and brightest line is mostly on the right side of the body, on
Yeah,
the right
Yeah,
eye.
yeah,
And it's saying he has to be always right.
mm-hmm.
right.
Okay, right side, right,
Yeah,
being
Be
always
correct.
want to be right.
yeah, that's right. And he has a very strong attention for concepts, law, I mean things, correct things. You know, the things that he follow, beliefs, religiosity, all these things, you know, law and whatever, it must be very 100% online, right? Can't be nothing more or less, yeah. And that's for him. It's very hard. It's very hard. He spent loads of energy on that for the whole life, and now it's it's been problem because he really lost a lot of energy during his life, right? So his vitality now it's weak, yeah, and he's having this kind of lines, yeah, being feed, yeah, uh, um, and showing that that's still on this kind of feelings. He's 80 years old, but he's still, I mean, very strong mind on these things. Yeah, so it's hard for him. Probably relationships is not very easy for him. Even the family, probably. Yeah, Leonard, Nenita.
True again.
Okay.
Yeah, that's true. Um, we're good. We're going kind of a little long here, so I'm just wondering if we should answer just a couple of these before we close.
Okay.
Obviously, I mean, we're going to need. We're thinking about it. With your permission, you folks, we're going to do this again next Thursday. We'll do it. We could maybe continue with Gary because there's so much more there.
It's a large webbing,
Yeah,
yes.
it's large webbing end too. Good call, Miriam.
Um, um, yes, so in addition to what Andre was saying about this person always wanting to be right in certain, and we have experienced his sort of um, guidance in
Hmm.
certain areas because he are precise.
Yeah, he has to be really precise the way
Precise.
Yeah.
he learned it. And, it can be helpful, but this is one of his characteristics. It has to be done this way. This is the way I was taught, and this is the way it must be done.
Hmm.
So it's interesting that you found that.
And
It's very good.
this, it might be related that when things not happened like this for him, like he would like it would be, then he get anger, he get uh, um, uh,
Upset.
Depressed.
upset.
Yeah,
Yeah, upset. Exactly, upset. He get upset. He get nervous. He get anger.
that's true. We're going to verify that.
Okay.
So anyway, I would like to ask people if they would like us to continue. We're going to have to bring this to a close now because we have a whole
Yeah.
lot of things we have to do yet. But if they would like us, if you folks would like us to continue this with Gary, or should we do another person next time? We're going to
Next
do this
time.
again next Thursday,
Same time.
same time.
Yeah.
And you're welcome to join us. There's so much more detail. We could bring in some things that we learned from his physicians, surgeons, because he did have bladder surgery, as I mentioned, to remove a few little cancerous signs.
And
Okay.
also, some people were asking where they could, if the map would be available, so you could address that question to Professor Andre.
So please just
So,
email him. You know his email address, and he'll make
Yeah.
sure that you get that
Yes.
map.
Yes. Okay. Thank you, Leonard. This is my map about the emotional correlations in the sclera. Okay. I'm working on the translation from Portuguese to English, right? To have it for all of you as soon as possible. Okay. I'll tell you as soon as we have it translated to English. Okay. And about how to learn about this, I'm planning also preparing the all translation, all these courses. We have all this course in already in Portuguese, but we are working on the translation to English, okay, to be able to offer to all of you with of course the support English with English specialists to help me to express as much better as possible, and to as soon as possible to be able to offer sclerology, emotional, vibrational course. I call psychoenergetic because it involves energetical system and the psychological part. Yeah. So and that's I work together with the whole thing on sclera, and as you saw, also we have in the iris. Okay, all this in the iris as well. Okay, so thank you, thank you to making
yeah,
part.
and I would like to add that those people who already both know iridology and sclerology, there's always other dimension on the study of it. It's not just one thing or a couple of things. We are, as we call it, a whole being,
Holistic.
holistic. It's
Mm-hmm.
not just the physical, it's not just the emotional, it's not
Mental.
the mental, it's the
Mhm.
whole gamut of things that make us whole
Mhm.
as human being.
So it looks like, sounds like people would like us to continue on a little bit more on Gary
Yeah,
and maybe introduce another
I think,
person.
Leonard, yes, yes. Many people are saying, asking us to continue with Gary case next week, and I think it's nice. I make many notes about emotional things to keeping talking with you and asking about more information about him.
So we can show or build or expose his emotional profile.
Profile, yeah, yeah, yeah. So we can do the whole history of his profile on as chronologic, emotional, quality of emotionals, and intensity of emotional each time on his life, and what it's on now and how much he doesn't be able to express his emotions, his feelings, his thoughts, because he's a rigid, because he's afraid about what he's going to say, what people are going to think about him, so people doesn't say. But the sclera shows on the real time all that, and we relate with physical body and have the whole connection. So we are able to treat the ones as an integral treatment. Yeah, not
We will
only
also
them.
talk about the treatment, some more treatment principles next time. Okay,
Yeah. Okay.
how we address them.
Yeah.
Get out the baseball bat and chase him around and see if he understands what we're talking about. Right?
Yeah. Yeah.
And also, I would
Okay.
like to add that a lot of people don't realize it's just like the physical is the last manifestation of the disease process.
Right.
Before before it shows up as as a physical, it has gone through the whole line,
Hmm.
or all aspect of our human being before
Psychic,
the physical even shows
mental.
up.
Right. So
Yes.
we'll get
Physical
into that and
body.
more next time. Hope everybody enjoyed this.
And we
So.
are going to use the same links for people.
Yes.
Yep.
Okay,
Let's.
Mhm.
good.
We are going to
Okay.
use the same link just next week at the same time. Go to the same link.
Eyeballs. Okay, everybody. See you next time.
See you next time. Bye bye.